What's up, YouTube? What's good? What's good? It's your boy Julian, aka Day, and I'm here to just give y'all some updates, talk with you, see how y'all doing, tell you how I'm living. All right, cool. Let's go. Let's rock. All right, so it's been a minute since I last did an update for you guys. It's been a while. So I'm gonna just touch on a few things. Um, First and foremost, I hope everybody's doing okay. Hope everybody's doing good with this Rona, getting back to some sort of a semblance of real life again. um, you know, Corona has knocked us down, but hopefully everybody, for the most part, is doing good, getting back to normalcy and living your life and your best life at that. So it is what? September 2021, and it's been a few years now since I first started on this journey and made my first video discussing about how excited I was to even get started and what I was looking for, what I was anticipating, hoping that everything was going to go good, and how excited I was about that, right? Yeah, then we did a few updates here and there saying how things was going. I think my most memorable video was when I talked about how close I was to having top surgery. And then when I was 2 weeks away from having that surgery and they got canked because of Rona. Man, listen, I was so excited. I was so hyped, right? Y'all remember that? Y'all remember that video? Oh my God, can't nothing stop me. Come hella hot water. I'm going to have top surgery. I'm going to be on that gurney. What happened? I was sitting right in the house. Mad as hell because I was not sitting on that gurney. But it's all good because, everything happened for a reason. I still don't know what that reason is as far as Rona, but the reason I wasn't on that gurney apparently would be so that I wouldn't have got the Rona while on the gurney, right? That's how I'm going to look at it. All right, cool. Fast forward, surgery went well. Actually celebrated 1 year post-op on top surgery on July 29th this year. Everything went great. I had an outstanding doctor, Dr. McPhee in Raleigh. She was out of Raleigh, but she's now currently in Durham, North Carolina. So that went really good. She did me well. And if y'all check out her website, Dr. McPhee, you will actually see my photos up there. You won't see my face. However, you will see, the top area and before and after pics. And you'll know it's me because you'll see my tats. You'll see it. And I'll be up there and you'll be able to see what the outcome of that surgery was. Fast forward some more. I've done some more updates on how everything else was going. And now it's time to get some more updates. All right, cool. So we done had top surgery October 12th, 2020. I had phase 1 of bottom surgery. Now, as you all know, and if you don't know, I'll inform you, there are 5 versions of bottom surgery that you can get, okay? And you have, and it depends on where you're at in your life, what matters to you, what you're looking for, what you're not looking for. If you're looking for bottom surgery to help appease you for your intimate life, if you're looking for bottom surgery to appease you just for yourself, there's a lot of different areas of why you may decide to get which bottom surgery you decide on getting. So there's the first 2 that will allow you to urinate and all of that. Sorry about that slight pause, y'all. Kieran being greedy. Nah, but so there's different surgeries, as I was saying. There's some that allow you for usage to stand up, urinate, that part. Then there's some that will allow you to also perform penetration during your intimate life. And there's ones that will not. However, it will still fit the bill that is, with the need for bottom surgery. Oh, you know what? My lovely pillows are not even, I mean, not pillows, my balloons. My lovely balloons is not in my picture. There we go. Y'all got to see my balloons. Hold up, hold up, hold up. See my pretty balloons. You see? Oh, yeah. I got those at Pride. They're so nice. I convinced my wife to let me bring them home. She won't try to let me bring them home, y'all. But I got them. See, I got them. Anyway. All right, now, for real. So, October 12th, 2020, I had phase 1 bottom surgery. I decided on ALT bottom surgery, not ALT free, but ALT. What is the difference, you ask? So, ALT free on bottom surgery, and I did my right leg. So what ALT is it allows the doctor to take the donor site from your leg and create your member. And free means they utilize and create an artery for the blood flow. So it's a freestanding blood flow. Okay. The ALT that I have does not allow for freestanding blood flow. So an artery that's already present in my leg was rerouted to my member. So with that particular surgery, the odds of things working as it's supposed to work and healing properly are at a greater percentage. So the ALT free has a higher percentage of failure, even with your best doctor. It just doesn't take a lot of times. So after talking things through with my doctor, and of course lots and lots of research, ALT was definitely my option. Now, why did I choose my leg as opposed to my arm or my side or metodioplasty? And I went with phalloplasty also. So that's phalloplasty ALT, not phalloplasty ALT free, not metodioplasty or any of the other ones. And the reason why I did that is because I am very, very, very much so about aesthetics. I'm all about the aesthetics, okay? Also functionality. So for me, in my way of life and my desires, I need the full functionality across the board. So we're talking for intimate life, I definitely needed to be able to perform penetration. For restroom usage and all of that, I definitely needed to be able to stand up to urinate. What else? Also, and most importantly, so the way they have to perform the surgery with cutting the donor site and getting the skin and the tissue and the blood cells, the fat tissues, the arteries, the veins. So when they cut it, you get a chunk that's about yay thick. Yeah, about yay thick, because they cut all the way through and everything stays intact, and then they just form it, right? So number one, it's really pliable. The fat cells really pliable, nice and plump and good and solid to give, everything from girth, length, to create the full functionality that I so desire. Now, yes, you can do that with your arm as well, which is RFF, and you can. But here's the difference. So, utilizing your arm. Now, first off, as you can see, I have a small arm, right? Got a small arm, really small. Okay, the skin is a lot thinner on your arm as opposed to rather to your thigh. Um, so for me, and what I'm looking for full aesthetics, you talking girth, you talking length, and everything. Yeah, just if you picture in your mind, you'll see exactly why I went with my thigh. Okay. All right, cool. All right, now that we bypassed that, let's go on, continue. Okay, so after getting that surgery, everything went great. My surgical team is outstanding. I go to the Crane Center for Transgender Surgery in Texas, Austin, Texas. They also have a facility out in San Diego, California. Um, Texas was a better fit for me. They utilize Blue Cross Blue Shield, which is what I have, as well as a lot of other insurances, and they also even do self pay, which could be a thing. It was almost a thing for me, um, and I was gonna. It might have took forever, but I was willing to do it because this was just that important to me. However, they are very, very good, very good. They are the best in the country, and not just by my standards. They are slated as the best in the country, statistic wise. So their statistics alone. So they have if I'm not mistaken, they have like a 95 percentile rate of success rate. Okay, and I know a lot of people. One of the reasons why a lot of people opt out of bottom surgery is because they're worried about sensation. They're worried about whether they're going to be able to feel anything um, during you know once their life comes back to normal. So I'm gonna say this. So first off, they have a high rate of, if I'm not mistaken, it's 86, 87 percentile of their clients get all their feeling back. There is a about 5 percentile rate, and my numbers might be off a little bit, but I know they said it's about a 5 percentile rate that some people get partial feeling, and then 1% get none at all. So you talking the majority of everyone's surgery that they perform gets full sensation. So that's a topical sensation. Just this like going like this and being able to feel that, or have taking a pen and feeling it. You're talking about internal sensation, um, and everything. So yeah, that part. um, I mean, they're just good, and then they care. They truly care about their patients. Truly, truly, truly. And if you leave it to Dr. Crane, he feels as though every single insurance company is supposed to be paying for it. And that's just what it is. And I applaud him for that, and I definitely appreciate him feeling that way, because that's important. You don't normally get doctors that feel that way, and he does. He's not just out. Granted, he's getting paid. Granted, but him and his staff, his team, they really care, like truly, and they fight. And when I say fight, let me give you an example. So, and this is coming directly from Dr. Crane, and he did a video during the height of Corona to explain how he fights and what he does and what he says to get these doctors to see that it's truly necessary. For example, um, so a lot of times with bottom surgery, insurance companies feel that it's cool for them to pay for everything except for scrotal implants. All right. So you figure you get a whole young man out there, goes through his surgery, gets everything, and then when it comes to getting the scrotal implants, they don't want to cover it. They don't want to pay for it. They're saying it's not necessary. It's not medically necessary. So you sit there and you think about, how is that not medically necessary? So this is what he does. So, and this is how he broke it down. So you have a woman who may have had breast cancer or something of the sorts, right? And they've had to get a double mastectomy, a bilateral mastectomy, which is, in basic, in essence, it's when you get both breasts removed, right? Bilateral mastectomy. So once they get that done, with it, it's very odd to have a woman walking around with no breast, correct? All right, cool. So then they get what? Breast implants. Now, outside of why most people get breast implants, if you think about it, and this is how he breaks it down, the medical necessity of breast implants is absolutely nothing other than it being aesthetically necessary for a woman to look and feel as a woman, right? The breasts are for what? The true function of the breast is to feed a child, to feed a baby. So you take away that woman and the possibility that she may not have kids, or Kids might be grown and she's not versing. If she's not nursing, she's technically not utilizing her work. So there's no more functionality to that, correct? All right. But the insurance companies will still believe that, hey, it's unnatural for a woman to walk around with no breasts. All right, cool. So why is it just not as unnatural for a man to walk around without scrotum? Come on. And that's his whole basis in his whole fight. There's other things he does and says to combat these insurance companies that doesn't want to pay. But when I think of my doctor and having that concern and being able to dive deep and make things make sense and tell the insurance company, you make it make sense to not have this young man walk around fully with all his parts and pieces. I can appreciate that. I can sincerely, wholeheartedly appreciate that, and I do. And that's why I will never go anywhere else. And I will always and forever refer anybody and everybody there. And I have. I've already referred a few people there, and I will keep on doing it. Okay, so there's that part. So had phase 1 in October. Everything basically went great. Everything surgically wise was outstanding. I heal well naturally on my own. Plus, I'm very healthy, so that helped. Plus, I did all my research, knew the things that I needed to do and not do during and after surgery. Paid attention to my doctor and everything went great. I did, however, have encounter a minor healing issue, and it was one when you do your research, it is one of the things that can possibly happen, but it's on the lowest spectrum of like it being minor or major. So it was actually a minor issue, but it, however, became major for me. But it was no fault of my doctor, no fault of mine, but every bit of the fault of the local hospital where I lived. So I had what was known as a stricture. So as my body was healing, and it was building scar tissue to heal, the scar tissue grew in thicker than in one area more than all the other areas. So that thickness of that scar tissue created what was a blockage. So it made it very difficult for me to urinate. So I went all day having this issue. And as the day went on long and long, it became harder and harder for me to urinate. So, noticing what it was earlier in the day, paying attention to it, noticing what it was by, the end of the day. I contacted my nurse. I know what was going on. She, in fact, said, yeah, okay. Sounds like, and I was like, yeah, that's what I felt like it was. And after the research, that's what I know what it was. Okay, cool. Go straight to your local urgent care, emergency room, tell them this, and that. You have your medical record, your medical chart from the surgery forwarded to you. Give them this, tell them you need to see this particular type of person or this person. So it was a special, either urologist, a special urologist, or a some type of. It was another type of doctor. I can't think of what it was. So I get to the hospital, and I'm waiting. I finally get called back. I tell them what's going on. I tell them what's going on when I get signed in, and it was like they were totally oblivious. Now, granted, the odds of them treating someone of my nature very slim to none. And that was understood, which is why I was sent with my surgical papers, right? But they were making life extremely hard, and saying what they didn't have. However, one of the doctors that I needed to see, not the urologist, but the other type of specialist, had just left, right? So it was like, okay, he just left. Call him back. He's on call for the night. Call him back. They wouldn't call him back. So, I'm tripping on them. And I'm like, you know what? Cool, no problem. Call my nurse. I called my nurse. Called her on speaker. Had her on speaker and informed her what was going on so she could talk to these nurses. So when I tell you she lit a fire up under those nurses' tails, a fire, okay? She lit a whole forest fire up under their tails. Okay, so to get the doctor on the phone. Doctor comes, I get seen. However, now a little bit of medical knowledge. So the human body can hold 1,000 cc's of urine in their bladder before risking potential explosion of the bladder. Basically, the bladder will basically just burst like a balloon because it can only hold but so much liquid. Okay, so that's 1,000 cc's. When I got there, right, one of the things that she needed them to do was to literally drain my bladder because I was having bladder retention. So that meant I needed to receive a suprapubic catheter, which is something that I had right after surgery. Get a suprapubic catheter. So that's a catheter that's put in underneath your belly button directly into your bladder. Okay. So this is what they needed to do. And they didn't have to create the wound. They didn't have to create a whole new hole because guess what? I had one. I had just got finished having a suprapubic catheter in. So the site was still there, still fresh and not sealed because it wasn't healed yet. So all they had to do is pop it back in, basically. Yeah, this was not done. So by the time they had me seen and did an ultrasound on my bladder, I was sitting at just under 400 cc's of urine in my bladder. Okay, so sitting there. So I'm livid and I'm in pain. I can't urinate. Haven't urinated in over 24 hours. Hadn't had nothing to eat because I knew if I had something to eat, I was going to drink. So, and I couldn't drink because, I'm already gaining more and more fluid in my bladder and I hadn't even had nothing to drink. So I knew damn well that if I had something to drink, right. So the hospital also decided they wanted to give me an IV. We gonna give you an IV. Yeah, nah, we're not doing that. You're not putting an IV into my veins to give me fluids when I'm retaining fluid and I cannot urinate. It doesn't take a rocket scientist. Hell, it doesn't take a CNA to figure that out. All right, cool. So I'm still tripping, right? So doctor comes back in and they're like, look, we don't have the type of urologist you need to see, blah, blah, blah. We're going to send you off. So I'm thinking, cool. Y'all going to transport me. Fine. Ooh, no problem. The hospital right up the road, 45 minutes away. They're like, no, we're going to send you over here. And I'm like, wait, that's 2 hours away. Like, why would you send me 2 hours? So I'm like, yeah, we're going to send you there, but first we're going to check to make sure they got a bed open, blah, blah, blah. So I'm like, all right, whatever. They come back. Oh, we can't send you there. They have no room for you. All right, cool. Send me up the road 45 minutes away. They come back. No, we're going to send you to Chapel Hill. So, Chapel Hill, from where I lived, which was Jacksonville, North Carolina at the time, that was a good 4 hours away. About good 4 hours away from where I lived. So you're going to, and it technically wasn't a life or death situation at the time, so they're not going to medevac me. So that means they have to drive 4 hours and some change away. 4 hours away. Drive. Bladder still retaining fluid here. I'm in pain from hell. Yeah, no, we're not finna do this. So I'm raising hell right now. I'm raising Cain. They check my bladder again. Now, I am now sitting at like 600 plus cc's of fluid in my bladder. 6. So then it took probably about another hour and a half before the doctor came back in. The doctor comes in. He was like, oh my goodness, your bladder is now at 600 some cc's. We need to go ahead and get you out of here so we can do something. And we're going to go ahead and send you up here to this other hospital. The one I was talking about, that's 45 minutes away. We're going to send you up there. Like, why didn't y'all send me there to begin with? Like, why? So I get all prepped to send me out and get to the hospital. Let me tell you the great thing. That happened to me. So I ended up seeing the urologist that was trained formally by my surgeon. Like, are you kidding me? I couldn't ask for a better outcome than that. By the time I got to the hospital, now mind you, I have my surgeon's phone number. I have my nurse's phone number. But I called my nurse because, protocol, right? So my doctor called me on the way to the hospital. My surgeon called me, was like, look, you will be seen by this doctor who I trained, and he's going to take care of you. I get to the hospital. I wasn't even through the door. It wasn't even 10 minutes. I got in the door. I was prepped. and in the operating room. Yo, by the time I got inside the operating room and everything, I was sitting at over 800 cc's of fluid. I wasn't too far away from my bladder possibly bursting because of incompetence. But end of that story, it ended up getting fixed. I ended up having to wear a suprapubic catheter for 4 months, only because into I couldn't get into my surgeon yet, for him to see me back because I had to go back to see him. So what happened was the urologist put in a new catheter. They drained out my bladder and all of that. And after 30 days, every 30 days, I had to get my catheter switched out and everything. So, I definitely didn't like having to wear a catheter. At least it wasn't the regular catheter, but still. But, everything worked out for the best. I went in, got everything fixed up. I didn't even have to go in for like an extra special surgery. We did the repair work at the same time of my next phase, which was phase 2 surgery. So that was great. All of that was done at that time period. So everything worked out good. Coming up here in October. So October this year, when I will be getting my next phase, so almost a year, just before a year out, I'll be getting my next phase, which will be phase 3 of my surgery. And then technically speaking, I only have one more to go after that. But again, you heard me say before, I'm an aesthetics type of guy. So I will be getting one more additional to that. And it's called medical tattooing. So when everything is said and done, with all my procedures, what that will do is it will create colorization that is necessary. So basically, when a young man is circumcised, they have a discoloration afterwards. So the medical tattooing will allow for that discoloration. So I'm just about done. So I'm sitting at my halfway mark, basically. So I couldn't be more excited. Cannot be more excited. Everything is almost done. Everything is definitely coming to a head. Everything about coming to a head. Let me grab my charger. That my grandbaby fur cat is laying over. Plug y'all up so I don't lose y'all. There we go. Yeah, knocked out in a really weird position. So all my surgery is almost done. Man, when I tell you, this has just been the best thing. This journey has been great. It is great, and it's still going. I've been blessed with the way my surgeries have been going, and with the knowledge that I've been gaining and the research and stuff that I've been doing. I've been put in a place where other people that are trying to go and walk down this path can come to me and ask questions, and I have the knowledge for them. And the knowledge that I don't have, I can direct them somewhere to go for it. So I get people that come up to me, I get people that call me, I get people sent to me, and it's great. Anything that I can help, I'm here for it. If I can help you, if I can help direct you somewhere, or just give you info, or hell, just to talk about it. Just talk about the pros and cons, talk about why it's good for you, why it's not good for you, personally, or if you just want to shoot the breeze or whatever. I'm here for it. I'm here for it. I don't mind at all. I actually enjoy it. Also, so, we have a hard time, just in general. But just know, if you decide to walk down this path, that everything isn't bad at all. So you saw on my thing, I said that I was going to be talking about a few things. So one of the things that have happened to me here as of recently is I've gotten married. Um, I moved to a whole nother state on a whim almost. Well, ain't no almost about it. It was on a whim, but it was on a grown man's whim and a grown woman's whim. So for those that don't know, I'm 47. I'll be 48 here in a couple of months. Um, so every decision that I've made has been thought through completely, totally, on every spectrum, every outcome, every avenue possible. I've weighed all options and came to this very lovely conclusion to marry my lovely wife. And it's been the best thing for me. Outside of, it's been the best thing. She's amazing. And I'm just bringing that up because, walking down our paths, we tend to think that there's nobody out there for us. No one will love us. No one will accept us for who we are, who we really are. I tell you, live your true, authentic life. The moment you start living your true, authentic life, a lot of more things and doors is open up to you. And there's someone out there for you, with you walking in your truth. Don't walk in somebody else's lie. Walk in your truth. Now, am I going to say that it's going to be easy? Hell nah. It ain't going to be easy at all. It's going to be a lot of struggles. Personally, interpersonally, publicly. It's going to be a lot of struggle, but it's going to be well worth it in the end. Also, I am in the process currently of creating a nonprofit. And this nonprofit will definitely be geared towards people in our community that are looking towards having surgery. Now, I don't know, and I can't say for sure exactly how that's going to look in the end. But what I will say is I am planning on being someone and having my foundation there for people. And when I say people in the community, I don't mean people here directly with me where I live, in this community of who we are. And I am looking to cover everything from just knowledge, support, um, try to build, I don't know how I want to do it, scholarships or trust funds, so to speak, or gift awards. I don't know how it's going to be labeled just as of yet, but I'm working on it. So just stand by. I'm working on it. I have a lot of knowledge on different things, on how to gain help in different avenues. I've been learning different ways that different insurance companies can help, where to go. Um, and I'm learning more every day. So if I can be of assistance, even if it's just to guide you in a direction, I'm here for that. And I will help. So don't be afraid to reach out. If you have any questions, please reach out, ask your question. If you have a comment, you can drop your comments too. If you have a negative comment, you can keep that. You can keep that. I mean, it ain't gonna be no sweat off my brow, but I have people young and old, and I don't need any negative comments discouraging them. I'm not here for that at all, so don't do it. But other than that, like, share, subscribe, and you'll start seeing me a lot more often. And we'll be able to chop it up. I'll be able to drop knowledge, just joke around, ask questions or whatever. All right. So y'all take it easy. Enjoy the rest of your evening, and I'll holla at you.